Where are you anyway?
I'm in Salt Lake City.
Oh, hey. Oh, so we're gonna see
You
you, right?
guys are coming.
Yeah, so we're gonna see you during the run.
Well, you're going to see my partner, Peter.
Okay.
Peter Fisher, who organized the run. I have another obligation that morning, but yeah, they usually have a good turnout. It's gonna be nice.
Yeah, it's gonna be really nice. I've been trying to catch up on my running. I can do a 5K in 3 hours, but the event only lasts 2 hours, so I'm a little worried. So, well, thank you for joining us. On the drive, and because it's Skype, what we're gonna do is we're gonna record it, and then we will upload it onto our social media feeds. With the Google, the benefit is that we can be live at the same time, but it's okay. We'll work with this. So,
Yeah.
so on the Drive for Men's Health this year, we did a national survey where we found that a lot of men, about 4 out of 5 men, don't talk to their family members about their family history or medical history or any history. So based on your experience where you practice and when you've practiced, what are some of the excuses you've heard guys give for them not taking care of themselves?
Well, I don't even know that we get to hear their excuses. Sometimes we just don't see them at all, right? So,
Yeah.
and we know like the average man with testicular cancer feels it and presents for care 6 months later. So, I think in just my observation, probably like yours, is men are reluctant receivers of care. They don't want anything that's going to be a bump in the road of their life. They want things to be okay. They are, I think, are tremendously optimistic that if they sit it out, things are just going to get better. Whereas women are quite proactive. And then what we find is, the appointments made for men in our urology practice, probably 2/3 of those phone calls come from partners.
And that's actually, I would say, 2/3 is probably a very realistic number. I don't know how many patients I've seen, even with testicular cancer, even with things that these guys can feel that are dragged in there by their female counterparts. So it's amazing. And, we actually did a survey last year through Orlando Health, and we found that the top 3 excuses are men don't have time, yet the average guy in America is on social media 2 hours a day. They also are afraid of our finger. So my patients always ask to see my finger if they've had a previous urologist to see if I'm going to hurt them or not. And the third is they don't want to face the reality that there is a problem. And so one of the things that we've noticed, one thing that guys really, really, really don't get help when they're supposed to is enlarged prostate. And I want to hear your experience, because I've seen a lot more patients come in that are much younger, coming in with symptoms of enlarged prostate. And some of them are, when you look inside their bladders and you see their symptoms, they're pretty severe. And I don't know if it has to do with obesity or anything else, but I wanted to kind of hear your thoughts on that.
Yeah, well, I think it's not too very different than other health conditions. Hey, that men are less proactive about. I think that with regards to enlarged prostate, there's some expectations that as we get older, there's going to be troubles getting up in the night or spending a little more time at the urinal. I think also there's a tremendous amount of fear of what we might have to do for them if we are to evaluate them. And like you said, they're afraid of the finger. They're really afraid of the cystoscope. In 25 years of urology, I can't recall being asked to perform a TURP on a single patient who didn't already have a catheter. Men don't want that procedure. And if they have any understanding of the situation, they know there are pills. They've heard there are side effects. There's the surgery, and the surgery has plenty of side effects.
Yeah, so when I actually was a resident in training, I never really even discussed erectile dysfunction as a side effect of TURPs. I mean, when they needed it, we got it done, and then, by the time you're off service, but then you see, other patients that got TURPs, and they're having ED, and we want to blame heart disease or diabetes, but the actual, prostate resection, because we're using heat energy, whether it's laser or we're cutting, does have a lot of side effects with erectile dysfunction, with strictures and scarring. Retrograde ejaculation, it's where you orgasm but you don't actually see anything come out. So there's definitely significant side effects, and we're not trying to scare people out there, but that's definitely the case. Now, what are some things that men can do to kind of prevent some of these problems?
To my knowledge, we've never found there to be a prevention strategy for BPH. And this condition, just dropping back for 1 second, it's about the third or fourth most common diagnosis that is made on men, but quite honestly, I don't know a single guy who's over 50 who hasn't noticed some symptoms. It's just that, again, we're not presenting for care until it's dire. So in terms of prevention, I think what we want to prevent is a deteriorated, functioning bladder. And the way we do that is by early intervention. Like you said, you see younger guys, by the time you look in their bladder, they're shot. They have marked trabeculation. The muscle fibers are all drawn apart. They're not functioning as well as they once did. I think that's just a function of either the patient waiting or, somewhere in the healthcare system, a general reluctance to do something more definitive.
Hey, Dr. Gange, it's Dr. Parkhoddle here. So thank you so much for engaging with us. And,
Sure, thank you.
No problem. And I love the guys when they come in. I always have to tell them, listen, think back to when you were 15 or 16. Do you pee across the street or so? And then they're like, oh yeah, I don't pee like that, and so, because otherwise the first response whenever you ask them, hey, how's your urination, is like, oh, I'm fine, everything's great, and so
exactly.
And I think a lot for these younger guys too. I mean, these newer minimally invasive options like Urolift and things like that are just so dramatically better for erectile function protection, and those are real issues for young guys, and so it's something that we always kind of don't emphasize too much, and we kind of accept it as being part of the TURP procedure or the Roto-Rooter surgery, and so I think it's great to have these newer options.
Yeah, I think Urolift is pretty different than other minimally invasive things that we've seen in the past. And I was around clear back when we were stretching prostates with balloons, and then we had those horrible metal stents.
You don't look that old, man. You don't look that old to be doing that.
You have a lot more hair than I do.
Yeah.
So.
Yeah. So I think we've seen minimally invasive things come to play because, again, no one wants the TUR surgery. But then they've not really been very sustainable. They're not durable in their action. And those that have been done like in a less intense setting, like in an office setting, turns out these are pretty painful things to go through. So, I think most people have been hoping that we find something that fits that, tolerability and efficacy. Like, we want something that's going to allow men to choose something better earlier, right? To preserve those that bladder function.
No, absolutely.
So can you tell us, you are actually our first talk for this US Drive for Men's Health. Can you tell us about the Urolift procedure? Actually, we just got 2 emails in our office about wives texting us, messaging us about, hey, do you guys offer Urolift? So it seems like it's more female driven. They want this done. Can you kind of explain the procedure to us and exactly what it does and is and how it kind of helps patients? Because it's not for everyone, we know that. But who is it exactly for?
So I think that any man who's symptomatic, really bothered by his urinary symptoms, is potentially a Urolift candidate. So I don't think it's just for those guys who absolutely need surgery and don't want to have that procedure. In fact, I think it's more suitable for men who are on the medications that cause the side effects or the cost or the hassle. And then once we do an investigation, pretty simple test, we can determine if the prostate's the right shape and the right size. So it requires symptoms of bother and then some specific anatomical requirements. And then Urolift itself, designed by really amazingly smart engineers, is simply an implant, if you will, that's got 3 pieces. One's a metal piece that sits outside the prostate in the firmer capsular part of the prostate. Then there's another tiny metal piece that sits on the inside in the urethra. And between them is a suture, a tensioned string, effectively, that pulls the inside towards the outside. The inside of the prostate is soft. The outside of the prostate is pretty firm. So we anchor out on the outside and pull towards the inside. And then when that's repeated on the other side, and then a few more times throughout the prostate, what we obtain is a wide open channel, almost like what we see with laser procedures or TUR procedures in some cases. And we do all this. I've done this only ever in my office under local anesthesia since 2011.
So you do it in the office? And really?
I do it only in the office, and I do it only with topical anesthesia, with ice cold numbing jelly. We leave it in for 20 minutes. Occasionally, because of anxiety or difficulty tolerating a procedure prior, we might offer some Xanax or something similar, and that's probably under 10% of my patients. So by and large, I perform this procedure efficiently in the office with complete tolerability. I've never had to abort a procedure for discomfort.
So I actually saw at the AUA, the American Urologic Association, which is our big urology meeting, 16,000 urologists from across the globe. There was data presented on the 5-year durability. So, people always come into the office and ask us, well, even if I get it done now, how long is it really going to last? The 5-year data was actually, I think, pretty promising. That
so I was involved in that. I was involved in that trial, and Dr. Rareborn presented. And essentially, what it says is that if you're improved by a month, if we follow you up to 5 years, your improvement is durable. There are a small percentage of men, like 13%, who had to have another procedure in the treatment period. That's 5 years, 13%, just a couple of percent per year going forward. And so I think this is really, this allows this procedure really to stand apart from so many of the things we've tried before. And as was mentioned earlier, no sexual side effects, no erectile dysfunction, but now 30,000 cases worldwide, there's no ejaculatory dysfunction because we preserved the bladder neck. No one's ever reported it.
Joe was one of the first to have Urolift done in him, and he's at 100% right now. We're actually going to show his stream live on air on Wednesday, so if you want to tune in.
This is what I have to deal with on a daily basis. This is the kind of abuse I take on a daily basis.
So like the Urolift is a great option, but what can men do out there to avoid needing anything done? The medications, Urolift, or any kind of surgery. What can they do at a younger age to avoid needing any prostate procedure?
Yeah, I honestly don't think. Maybe with prostate cancer, if you're strictly a vegan throughout your life, your risk is lower. We can see that in some of the comparative studies from nation to nation, for example. But I think BPH is an inevitability. All men are going to have changes in their prostates. If they have testosterone in their bloodstream, they're going to have changes. So eunuchs, generations ago, eunuchs didn't get BPH or prostate cancer because there's no testosterone for those patients or those people. There's nothing you can eat. There's nothing no exercises you can do. I think, again, the most important thing is when you start to feel bothered, annoyance of symptoms like getting up at night or standing there a long time or dribbling down your leg when you're finished and, starting to really feel unusual, that's the time to present for some evaluation. Because if we intervene early, we can save those bladders.
Yeah, it's really unfortunate. I mean, at least once or twice a month, we see young guys with basically myogenic failure of the bladder, where it just gives up, and then it's very difficult to get that muscle strength back.
We deal with a lot of bodybuilders too that take testosterone replacement and kind of super high levels, and I kind of mentioned it to these guys that the same way that they're bulking up, unfortunately, it's probably going to have an effect on their prostate. As they
bulking
get older.
Up their prostate.
Absolutely. So,
Mini Arnold.
Yeah, you're talking about testosterone, sure.
Yeah. Like
or the anabolics.
Yeah, because some of these guys really take very high levels, and these are some of the things that they're not really informed about. That hey, your prostate's going to get bigger and stuff,
and your testicles are going to get smaller. You know, that they don't know that either.
Absolutely, absolutely.
So here's a question for all of us right now. So here's the question for all of us is, so if a guy is on testosterone for low testosterone and he has bothered symptoms, do you stop the testosterone or do you treat the bothered symptoms? I don't think there's a right answer to it, but you know, based on your experience, what would you say?
Well, there have been studies that number one show that prostates don't grow that much under the influence of testosterone, and the symptoms don't really become a major player. So I think address the symptoms, don't stop the testosterone. Testosterone can make people feel great.
You know, absolutely. Yeah. So, I mean, and I always tell patients that sometimes, you know, the bothering symptoms are really just a result of the enlarged prostate, and so.
Right.
And so, you know, we really have to fundamentally treat the problem, which is the prostate. And so that's probably what's going to be most beneficial for the patient.
Yeah, I agree.
And so, Dr. Gange, where are you located at, and where's your practice based out of?
Right. It's Steve Gange, Gange. I'm in Salt Lake City, in a multi-specialty clinic called Granger, and in a subdivision of that called Summit Urology. So I guess you guys will be coming to town for the race this weekend.
Absolutely.
Yeah.
Absolutely. So,
Nice.
So we're hoping, you know, every year we try to change the route a bit and stuff, but we'd love to continue meeting and hopefully meet up with you one of these days and, you know, drive through your town. And, you know, for the viewers online, you know, Dr. Gange is one of the foremost world experts on Urolift and probably has done, you know, one of the highest numbers out there and stuff. So, you know, we really are honored and privileged to spend some time and talking with you and stuff.
It's my pleasure, and I admire what you guys are doing. It's phenomenal. Really becoming a movement, and, you know, we appreciate how you're out there taking time from your practice and making a difference.
Absolutely.
Thank you, sir.
Well, thank you very much.
Great afternoon. Thank you.
All right. Thank you
Yeah,
very much.
you too.
All right.
See you guys.